Char, Director of the Department of Health. Both Dr. Char and the Governor will be taking questions from the media virtually once they have completed their remarks. And with that, Governor.
Thank you for joining us this morning. This morning, our reporting shows a big surge in the number of COVID-19 cases. We know that each of these cases is more than just a number. They are our family, friends, neighbors, and colleagues. Here's what we know. There are 797 cases today, and there are no backlog cases. On December 7th, the 7-day average was 101 cases a day. Now, just 10 days later, our 7-day average is 297 cases a day. On December 7th, our positivity rate was 1.4%. Today, just 10 days later, our positivity rate is 4.2%. And just yesterday, our positivity rate was at 3.1%. So we are seeing an alarming increase in the number of cases. We also know that what can help slow the spread of the virus is something that we have done for the past 2 years. Get vaccinated from keiki to kupuna. For those who are fully vaccinated and have yet to get their boosters, please do so. Wear your masks, especially as required indoors and in crowded spaces outdoors. If you feel sick or have symptoms, stay home, avoid other people, and get tested. It's really important if you have any symptoms to get tested as soon as possible. If you have been exposed to someone who is COVID positive, you should get tested, regardless of your vaccination status. And it's time to reassess your plans so you can celebrate with your loved ones safely during this holiday season. Now is the time to take extra precautions to protect those who cannot get vaccinated or kupuna who are especially at risk. We are continuing to research to understand what we're dealing with in this latest surge. Dr. Char will provide information about surveillance and sequencing to determine if what we're seeing is Delta or the Omicron variant or a mixture. Our best researchers and medical experts are working on this. The mayors and I are meeting today to discuss what type of protocols might be required going forward. The bottom line is that your life matters. Our mission is to stop the spread. It will take all of us to do that.
Thank you very much, Governor. Our next speaker is Dr. David Ige, Department of Health Director.
Thank you. Good morning, everybody. We're once again facing a surge in COVID cases. This is a mix of Delta variant as well as Omicron. COVID is surging worldwide and across the United States, and we're seeing more and more Omicron variant. Right now in Hawaii, our variant report came out, I think it was on Wednesday, and as of these specimens collected up to December 4th, 2% of our state cases are Omicron variant. They're all on Oahu, and if you just use the Oahu cases as a denominator, then we're at 5% on Oahu. But we know that that's going up. We have had 31 confirmed cases of Omicron variant as of last night. And we have another 17 cases that look very suspicious for Omicron that we are performing whole genetic sequencing on. And I just want to really thank the team at the state lab that has been working really hard and really quickly to try and get this information for us and to do the sequencing. They've been working hard at this since just a few months into the pandemic, as far back as June of last year or somewhere around there. So we have been doing surveillance the entire time. Omicron appears to be more easily transmitted, and it appears right now that it is less virulent, but don't be fooled into thinking that it won't affect our hospitals and our families. Perhaps the numbers in the hospitals may end up being worse than Delta, because if you think of it, like if you had a virus that infected 100 people and 10% ended up in the hospital, that would be 10 people. But if you have something that's super easy to transmit and it infects 1,000 people, even though maybe it only, 3% end up in the hospital, that's going to be 30 people. So it's kind of a false story that we're hearing, like, oh, don't worry about it. It's really mild. Why don't we just let everybody get it? It's just like getting a cold. If it's that easily transmitted, just by the sheer numbers, we're going to see people ending up in the hospital, and we're going to see people getting severely ill from it, even though it is less virulent than some of the previous variants. So we need to keep our case counts down. We don't want anybody to get infected. We don't want anybody to get really sick from this or to die. What can you do to protect yourself and your family and help the community? Booster shots. The vaccines help to protect us from getting severely ill. They help to keep us out of the hospital. And what we're seeing is that when you get vaccinated, you develop something called neutralizing antibodies, and that over time, the level of neutralizing antibodies tends to wane. So it kind of drifts down over time. We know that that third dose or that booster dose is tremendously important, because that takes your neutralizing antibody levels and it shoots it really high. So it gives you very good protection. It does not make you invincible. It will help to prevent you from getting sick or having a bad outcome. It's just becoming more and more important that we're seeing from the science that that third dose is really important. We're seeing more and more breakthrough cases of people who have had 2 shots, especially if it was a while ago. And if it's been 6 months since an adult got their Pfizer or their Moderna shots, please go get a booster shot. Don't wait, go get it now. If you got Pfizer and you're at least 16 years old, you can go and get your booster shot if it's been 6 months. And we have hundreds of locations around the state where people can go and get a free vaccine. The same things that we've seen all along and that we've been employing still work. They are our best defenses. These are layers of protection, and the more layers you use, the safer you're going to be. So wear your masks, keep your distance, small gatherings, really try and stay away from those super large gatherings. Good ventilation. We've said it all along, like outdoors is safer than indoors. Wash your hands. And please, if you're sick, stay home. Even if it seems like it's just really mild or you just have a scratchy throat or something, please stay home if you're sick. Have a plan. This is really going to become more and more important as we see our cases climb. Where will you stay if you get infected? Who's going to take care of your kids and your family? Who's going to take care of your pets? How are you going to get groceries? Who can drop groceries off to you if you can't be out and about and you have to stay home? So please have a plan ready. Discuss it with your family and your friends, maybe your neighbors. Maybe you guys can form a hui and help each other out. Make smart choices. Please celebrate the holidays, but celebrate them responsibly and spend time with your family and friends, and do so safely. You can very much control your risk of exposure to COVID, and you can limit whether or not you get sick if you do happen to get exposed. So please wear your masks, get vaccinated. If you've been vaccinated, please go get a booster shot. Keep your gatherings small and with people that you know and that are in your family. Keep your distance from others and head for spaces that provide good ventilation. Thank you.
Thank you very much, Dr. Char. We'll open it up to questions from reporters. We'll go to Nina Woost, our advertiser first. Nina.
Hi, this is for Governor Ige. Governor Ige, given what we know about the vaccines, that 2 doses are not as effective now, are you considering any changes to safe travels, whether it be requiring a booster shot to be fully vaccinated or considered fully vaccinated, or maybe a test 24 hours prior to travel in addition?
So at this point in time, we are not looking to implement any changes. We constantly evaluate the status on vaccinations and whether we will be requiring additional testing, but we are not making changes at this point in time.
Thank you. Follow-up question, or do we go around again? Okay, so also, what are we doing to prepare for this? Some say it may be the biggest challenge yet. Will there be more testing availability or any other sort of preparations? I know in New York, they're going to give out test kits and KN95 masks.
Thank you. Yeah, so we're trying our best to take preventive measures as best we can. We have been trying for the past couple months to increase the amount of testing availability and to use different types of testing so that we have places where you can go and get a PCR test, places you can go that are using point of care antigen test. We have also been trying really hard to procure home test kits. Some of the challenges are, once again, this is a worldwide incident and this is a nationwide pandemic. And so everybody's trying to get the same things. And so we've been trying for a couple months now to get home test kits, and we were able to get some, but not nearly as much as we would have liked. We were heading for millions and didn't quite get there, but we will try and have as much testing available as we can and make it as convenient as we can for people. Likewise, we have hundreds of places in December alone that you can go and get vaccinated. We have been partnering with schools. I think in December alone, we had 140 plus school locations to help the kids get vaccinated. So we're trying our best to make testing available, to make it convenient, and to also have vaccination.
All right, last question. On the other hand, if it does turn.
Sorry, I'm going on to Nicole Tam. KITV, go ahead, Nicole.
Thanks, Jody. My question is for Dr. Char. Can you talk about what kind of contact tracing information you can share as far as where people are getting sick preliminary based on this batch of surge of cases? Is it private parties, large gatherings, organized events? And can you also give an update on how many contact tracers we have?
I have that in my notes. I'll have to go grab it, but I think it has not really changed over the past 5 or 6 weeks, and it is several hundred statewide. I think on Oahu alone, it was like 261. So I want to say the total is like 390 or something in that range. I'll double check on that. We are seeing cases just throughout the community. It's just widespread community transmission. We have had a couple of notable clusters, and it's people who are doing the right thing and they're doing what they're told. The businesses are following the rules, but we're having a pandemic, and insofar as we have a couple of variants that are pretty highly transmissible, certain venues, people take their masks off to eat or drink. And so that increases your risk. It's indoors, that increases your risk. If it's really crowded there and it's packed with people, that increases your risk. And so it's just a higher and higher risk. And I think that's where we saw our latest cluster. And I think right now, it's up to 46 cases tied to that one cluster. And so again, you just need to evaluate, make smart choices, get your vaccine, get boosted as best as you can, wear your mask indoors and avoid really crowded places, head for outdoors if you can. But kudos to the businesses. I mean, they're trying really hard. They're following the rules. They're doing what they can. It's just a really difficult time. We're having a pandemic.
Thank you, Dr. Char. Nicole, I see you have a follow-up. Go ahead.
Yeah, I was just wondering, actually, the symptoms for Omicron. Have you noticed a slight difference from Delta as far as the symptoms? I know you mentioned scratchy throat, just little sick things, not so much dramatic symptoms that we've heard before about COVID. So wondering if there's a difference between symptoms of the variants that you're hearing.
I think for now, if people just kind of stick with the stuff that we've been saying all along, it's the same symptoms. It's still COVID. It's just that the variant has different ways to evade certain systems and attack in other places. So one of the things we're seeing is that we're seeing more viral load in the bronchial passages and less in the lungs, which is not to say it's not in your lungs. So we're seeing a little bit of a shift in that regard. But in terms of the symptoms that you'll see outwardly, it's still all the same thing. So if people, headaches, cough, shortness of breath, loss of taste or smell, just feeling really fatigued, fevers, all of that, it should all be the same symptoms. The point, though, is that if you have mild symptoms of something and you're not sure what it is and you think, oh, maybe I'm just coming down with a little bit of a cold, please don't make that assumption right now. That's not a safe assumption, and stay home, go get tested.
Thank you, Dr. Char. Moving on to Wendy Osher, Maui Now. Wendy?
Hi, this is also for Dr. Char. Are any of the 17 suspicious Omicron cases that you mentioned, are any of those on the neighbor islands? And are there any additional steps being taken on the neighbor islands to ensure hospital staffing is available in the event of a surge?
So that's a really good question. Right now, all the Omicron that we've seen, that we've confirmed is on Oahu. And I believe that the cases that are pending are also from Oahu thus far. I think it's inevitable at some point we're going to see Omicron cases on the neighbor islands, but right now it seems to be limited to Oahu. In terms of the hospitals and stuff, I think, all the healthcare association and their member hospitals are all very aware of this. I've been getting a bunch of text messages, and so they're asking questions and they're trying to be really proactive and step up and make sure that they are ready and they are prepared for, if we see increased cases in the hospital. So everybody's on alert, everybody's trying. And, kudos to our healthcare professionals and our public health professionals, because this has been going on now. We're coming on 2 years and people are tired, and yet they're stepping up again and again to help take care of the rest of us.
Did you have a follow-up, Wendy?
No, that's all. Thank you.
Nikki Shenfield, KHON.
This question is for Dr. Char. You said there was 46 cases tied to one cluster. Can you say what kind of events?
Yeah, I think it was in the newspaper. It was a nightclub. And the nightclub, I don't know if it's the owner or the manager or whatever, they have been super helpful in trying to, reach out to patrons and trying to work with the Department of Health. They've been just nothing but wonderful to work with. They voluntarily cut their capacity to 50% while we were doing investigation. They tested all of their employees right before shift. I mean, they're trying really hard to do the right thing.
Thank you, Dr. Char. Allison Blair. Oh, Nikki, sorry. Did you have a follow-up?
Sorry, yes, sorry, Dr. Char, another question. Is the Department of Health following the latest CDC recommendation on getting an mRNA booster over J&J?
So that just came out, and what Nikki's referring to is that we have essentially 3 vaccines here in Hawaii. 2 of them are mRNA vaccines. That's the Pfizer and the Moderna, and then the Johnson & Johnson, which is an adenovirus vaccine vector. And recently the CDC came out and they're pushing a preference towards the mRNA vaccines because of, while very low, it's still a very, very serious side effect from the Johnson & Johnson. And that's the thrombotic thrombocytopenia, the blood clots. So they're pushing and announcing a preference for the mRNA vaccines. We still have all 3. There are circumstances, especially people that have allergies or reactions to the mRNA vaccine. So we still have all 3 available in Hawaii, but we really haven't had any discussions with our providers yet because this just came out the other day.
Thank you, Dr. Char. Now moving on to Allison Blair, Hawaii News Now. Go ahead.
Hi, this question is for the governor. Throughout the pandemic, hospitalization numbers have been the gauge for determining restrictions. At what number of hospitalizations would trigger restrictions?
Yes, so we have not seen a significant increase in the number of hospitalizations at this point in time. For the past several weeks, it's been hovering between 30 and 40 COVID patients in the hospitals. But we also know, though, that hospitalizations is a lagging indicator. So we will see an increase in the new cases. That's a leading indicator. We do know that 7 to 10 days after that, we will see an increase in the number of hospitalizations. So at this point, most of the cases are Delta. And so certainly we do anticipate an increase in the number of hospitalized. We will continue to monitor that. We don't have a hard and fast threshold for that. And certainly I think we would monitor the number of new cases as a leading indicator to determine whether additional restrictions would be required.
And then I do have a follow-up question, Governor. Yesterday, we got a release saying that the state was standing down quarantine facilities. Why?
I'm certainly going to ask Dr. Chard to speak to that. Part of what we are seeing is that there were significantly less demand for quarantine spaces. As you know, the number of active cases have dropped, the number of hospitalizations. So there definitely has been a significant decrease in the need for isolation and quarantine units.
Thank you, Governor. Dr. Char?
Thanks, Governor. Yeah, with regards to the isolation and quarantine, that's pursuant to the last emergency proclamation that the governor issued on November 29th, I think it was 29th, that he was transitioning the control of the county's rules and whatnot back to the counties. And so it's kind of twofold. So partly we had a huge inventory of isolation and quarantine that the state was taking care of. And so we let the counties know that we were going to be transitioning that over to the counties, that they are responsible for isolation and quarantine. Additionally, I don't think we need the kind of volume that we had initially. I think that can definitely be ramped down. But overall, the coordination for isolation and quarantine is going to be a county function as of the end of the month.
Thank you, Dr. Char. Audrey McAvoy, Associated Press. Audrey?
Thank you, Jody. I'm wondering if the surge that we're seeing now is related to Thanksgiving gatherings at all, and if so, if that will affect how you recommend people spend their year-end holidays.
I think what we're seeing now in terms of the surge is just a combination of things, and it's hard to really isolate one thing versus another because people typically are engaging in several of these things. So there's been an increase in travel and holiday travel and returning residents included. That's a big part of it from places that have a lot of COVID. Just people are getting together more. And so you're also, in addition to getting together for family parties, you're getting together with people that you haven't normally been in contact with. And so that's exposing people to more risk. And then, you know, people have been more in a festive mood. So they've been out and about a lot more. And those activities like, you know, going out, large gatherings, huge concerts where you're with 8,000 people, nightclubs where you're with a whole bunch of people taking off their masks indoors because eating and drinking at some of these events. These are all just risks. And so I think just the confluence of all of these risks all piled together is what we're seeing. And we expected to see a little bit of a bump. I didn't think it would be quite this steep. And then I think with Omicron getting added in there, now that's just a complicating factor. And I think it's just all these things mixing together.
Thank you. Did you have a follow-up, Audrey?
No, I'm good. Thank you.
Okay, going on to Anita Hoff-Schneider, Civil Beat.
Hi, this question is for Governor Ige. This was a follow-up to an earlier question. When he answered, he mentioned that he's not making any changes to the safe travel program for now. And I was wondering, you know, given what we know about the science of the importance of boosters, whether there were, like, what pros and cons that he's weighing in terms of, you know, whether or not to require boosters or people who are flying into the state.
Yeah, certainly. Thank you for the question, Anita. We are following the CDC and looking at what their recommendations are in terms of whether those who have had 2 doses right now are fully vaccinated. They are recommending boosters, but they are not suggesting that only those who receive boosters should be considered fully vaccinated. So I know that we do have the flexibility to examine and do different things, but at this point in time, you know, the number of cases that are tied to travel is continues to be relatively low. Most of the cases are actually residents who may have traveled or community spread.
Nina Wu, Star Advertiser. Sorry, Nina, go ahead.
Hi there. Yes, just one more follow-up question. I know there is no crystal ball. If it turns out Omicron is not as severe and we don't have as many hospitalizations, will you be easing, for instance, quarantine requirements for those that test positive? Dr. Char, would this make sense or not based on science? And when might we know? Would it be after January, February, March?
I mean, so we follow the recommendations with regards to isolation and quarantine from the CDC. And so I think if you remember back to early 2020, it was a full 14 days because that's the incubation period. And then as they came out with more data and they saw that most of the infectivity and the transmission is going to happen earlier. And so they shortened it to say if at 10 days and you don't have symptoms, then you can be released from quarantine. So we tend to follow that data and follow the rules that the CDC makes on that. As far as Omicron versus Delta, again, don't be fooled. It may not make everybody as sick, but certainly some people are going to get very sick from this and end up in the hospital. And even if just from a numbers perspective, it's not making people as sick, but if it's infecting so many more people, even if it's a small percentage of a really big number is still a pretty big number. So the hospitals and whatnot are definitely gearing up and they should be. I think they're doing it smartly.
Thanks, Dr. Chair. I'm going to go back to Anita. I believe we had a follow-up, Anita. Go ahead.
Hi, yes, I just had a follow-up for Dr. Char. I was interested in the percentage of breakthrough cases. I saw earlier this week, like over 20% of hospitalizations were breakthrough cases. Can you share any updated data on that, as well as, you know, your understanding of the percentage of the new cases we're looking at that are breakthrough?
So I think most of the hospitalized breakthrough data is going to be on the hospital side. I don't have a database for that. Statistically speaking, as more and more people get vaccinated, we will see more and more breakthrough cases because now a larger percent, I think we're up to 73 point something percent of our population is fully vaccinated now. So it's just more and more people in our population that are vaccinated. But also what we're seeing is over time, those 2 shots provide you really good protection from getting severely ill or ending up in the hospital. But over time, the neutralizing antibodies start to wane. And so that's why we're pushing really hard. It's becoming increasingly important for people to please go get your booster shot. That's going to boost your neutralizing antibodies. That kind of is a reminder to your immune system. It wakes it up and it gets it geared up again. So those booster shots are just increasingly important. Go get your booster shot if you haven't had one.
Thank you, Dr. Char. Nikki Shenfield, KHON.
And Dr. Char, it's believed that Omicron can double in about 3 days' time. And on December 4th, it was about 5% of the cases on Oahu next to Delta. But with the sudden surge, what do you believe that percentage of Omicron cases is today, or how soon do you anticipate Omicron to become dominant?
So the models and the data that we've seen, a lot of it comes from South Africa and a bunch of other data comes from the UK. So we have to be a little bit cautious in trying to draw conclusions for Hawaii. We are at 5% Omicron for Oahu. And if you look at state numbers overall, it's about 2%, but that was for samples as of December 4th. So we know that we've had a bunch more. That was, I think, that as of that date, it was like 14 cases. We know we've had 31 now. We've got another 17 pending. So I would imagine that if we follow the trend like several other places, it will become the dominant variant. How quickly that will be, off the top of my head, I don't know. But I'm hearing for the UK that they're looking at the end of December that will be the dominant variant. Some people are saying by Christmas. For South Africa, it's already the dominant variant. And I think for us in Hawaii, certainly, you know, if we continue on this trend, I think early next year, very early into next year, I wouldn't be surprised if it was the dominant variant.
Nicole Tam, KITV.
This question is for the governor. The National Guard reported their COVID-19 mission is ending today for 500 guardsmen. Will that be on hold because of a surge in cases? And if not, who is going to take over their duties?
Yes, I spoke with Major General Hara just before this press conference and asked him to reevaluate the schedule for the Guard. He is putting on hold the downsizing. They are making an assessment. we probably will be extending some of those guardsmen for additional duty.
Sorry, so to clarify, it is on hold then? Does that mean that ceremony, the Mahalo ceremony is not happening because some of them will be going back to work? And do you know like the number of how many people are going to be extended?
No, I don't have that number with me at this point in time. General Hara and his team is evaluating, what would be necessary to extend, and then we will be having an announcement shortly. So I did want to make the community aware that we have seen a surge in the number of cases of COVID-19. We all know what's necessary to reduce the risk to you individually as we enter the holidays. We know what works. Wear your mask indoors, wash your hands, and use hand sanitizer. If you get any symptoms, even no matter how mild or how much you feel like it's just another cold, please go get tested and isolate until you get the test results. We do encourage you to limit your gatherings this year, maintain physical distance, especially for those who you are not aware of the vaccine status, or if they are people who are traveling. All of those things increase the risk. I do know that